Good morning. First, I would like to thank Dr. Hisham Said, Dr. Magdi for their support of this project. Of course, Dr. Shaimaa Zaki and Dr. Muhammad Fathi for their contribution in this study. Our study, the effect of hemodiafiltration versus high flux dialysis on middle and large molecules reduction and its relation to albumin loss using weak surface area dialyzer 2.6 meters square. Uremic toxins are defined as molecules that accumulate in kidney impairment and have an adverse biologic effect. They can broadly be classified into three groups: small water-soluble molecules, middle molecules, and protein-bound solutes. Most of the hemodialysis techniques remove small water-soluble molecules. Convective therapies and highly permeable membranes are known to remove medium and large-sized molecular weight solutes, giving higher dialysis adequacy, but associated with higher transmembrane albumin loss. Aims of our study was the assessment of medium-sized molecules, including free light chains, alpha-1 microglobulin, interleukin-6, and procalcitonin reduction in patients undergoing high-flux dialysis versus HDF using high-surface area dialyzer. Another endpoint was assessment of cumulative albumin loss in patients undergoing high flux versus HDF using dialyzer 2.6. Our study was a crossover study. 25 end-stage renal disease patients on regular hemodialysis were recruited from Ain Shams University Hospital's hemodialysis units. Our inclusion criteria was age ranging from 18 to 60 years old, prevalent hemodialysis patient undergoing dialysis sessions for more than 6 months, 3 sessions per week for 4 hours. Avascular access was AV fistula. All hemodialysis catheters with patients were excluded. Patients with active inflammation or infection, decompensated heart failure, liver cell failure, child B or C, or patients with known malignancy were excluded. Dialyzer used was a Burema 260 high flux, superflux polyether sulfone hollow fiber with steam sterilization with saving coefficient of myoglobin 0.7 with effective surface area 2.6 meters square. All patients underwent hemodialysis by 2 modalities, conventional hemodialysis and online post-dilution hemodiafiltration, using the same filter of Burema 260H. Wash-out period was 2 weeks using high-flux dialyzer. Maximum surface area was 2 meters square. Pre- and post-dialysis levels of medium-sized molecules were all measured upon a single dialysis session by ELISA. Dialysate albumin was measured by microalbumin, was collected after the half, first and second, third hour at the end of the dialysis session to estimate the cumulative albumin loss. Reduction ratios for all solutes were measured. Kappa and lambda ratio were calculated for free light chains. Correction of post-dialysis levels for net ultrafiltration of the middle-sized molecules were calculated. Total albumin in dialysate were calculated in grams. Cumulative albumin dialysate loss was the sum of all total albumin calculated in dialysates. Our results showed that there was a statistically significant reduction between the pre and post levels of all molecules on high flux hemodialysis using our filter 2.6 meters square with p-value less than 0.001. There was also statistically significant reduction between pre and post levels of all molecules on HDF with p-value less than 0.001. This graph shows the reduction ratios between different molecules between high flux hemodialysis and HDF, with average kappa reduction ratio 29% on high flux, HDF 45, lambda high flux 19%, with 28% reduction ratio on HDF. Alpha-1 microglobulin showed 27% reduction ratio on high flux versus 41.9% on HDF. Interleukin-6, 32% reduction ratio on high flux versus 44% on HDF. Procalcitonin, 41% reduction on high flux versus 50.3 reduction ratio on HDF. And urea didn't show reduction ratio difference, but it was also statistically significant. This graph shows the albumin loss in dialysate on both high flux and HDF. The maximum dialysate albumin loss was over the first hour. with total median of dialysate loss on HDF with 2.46 grams on HDF versus high flux 0.65 over the 4 hours. This shows the hourly variation in TMP over over high flux filter versus HDF, with higher TMP readings and also statistically significant over HDF. Both modalities of hemodialysis showed statistically significant correlation between total albumin loss and mean TMP, with higher statistically significant over HDF with p-value less than 0.001. Our conclusion that BiPure 260 high flux dialyzer with effective surface area 2.6 is effective in medium-sized molecules removal, especially with online post-dilution hemodiafiltration with acceptable albumin loss. Thank you.